Good morning and welcome to part 2 of SGR's writing tutorial. My name is Tess and I'm one of SGR's OET trainer. I'm also a CELTA teacher and I'd like to welcome all the candidates watching from the UK and also good afternoon for everyone from the Middle East, from Central Asia, and those watching in the Philippines and other parts of the world. So last week, Grace facilitated a discussion on OET referral letters. As you all must be aware, the OET letter is usually a referral, but other types include a discharge letter, a transfer letter, or a letter to inform or advise. So today's lesson is all about writing a clear and concise discharge letter. So before we start with the lesson, I'd like to give you a format of our lesson for today. And so I will be facilitating the lesson and there will be some time later after for some of your questions and I will try to answer them as best as I can. Okay, you can send your questions beforehand. You could type it under the comment section so that one of our OET teachers will be able to be is on hand to monitor your questions and forward them to the OET teachers so that we could have a look at them. All right. Okay. So let me just go back to my presentation. So we found that there are three key areas where most students struggle with in the OET writing task. And these are content, conciseness and clarity, as well as organization. So therefore, these will be the focus of our lesson for today. So you will learn to identify the information that your reader needs to provide in the recovery and care of the patient. In other words, making sure you don't leave out the information that is necessary for the reader to know. You also need to convey the information presented in the case notes without changing the meaning in any way. That is what we mean by learning how to pick relevant content and be accurate, which is under the criterion of content. Next, to achieve a high score in the criterion of conciseness and clarity, you should learn how to identify and exclude irrelevant information that could distract your reader from the main message. Conveying the information your reader needs to know in the most efficient way is also essential. Finally, we will look at another very important criterion, which is organization. Here, you should logically divide information into paragraphs and order them in a way that is most suitable for your reader, meaning it makes it easier for them to find the information they need from your letter. Remember, this is not necessarily the same order in which the information is found in the case notes. So let's start by discussing what is a discharge letter. A hospital discharge letter is traditionally a brief medical summary of a patient's hospital admission and the treatment they receive whilst in hospital. It is usually written by one of the ward doctors, or in the OET exam, ward or charge nurses may also be asked to write one. Also commonly referred to as discharge summaries or a letter to the GP, it details the events of a patient's admission to the hospital up to the time the patient is about to leave or to be discharged. Let's look at the purpose again of a discharge letter. So let's ask ourselves, is your purpose to advise a general practitioner, a GP, a family doctor about care after discharge? Then that means that your approach should focus on the discharge instructions, i.e. treatment plan, medication, and care required, rather than social history or medical history, as the GP would be aware of the patient's background. For nurses, if your purpose is to advise the patient's nursing care home about care after discharge, then again, your focus should be on the discharge instructions, that is nursing management and further care required by your patient, again, rather than focusing on the social history or medical history of the patient, as the patient's care home would be aware of the patient's background. So Having looked at the relevant um, information about discharge summaries, surgical consultants specifically felt that the routine inclusion of social history is not necessary and should only be included if relevant, i.e., if there are any risk factors for illness or if there are barriers to discharge planning. Let's take a look at a nursing writing task example. So this writing task is about writing a discharge letter to Denise Pesica, nurse in charge at the Rosewood Care Home, 44 High Street, Newton, where Miss DeSanto is a resident. So in this writing task, we have several information on this very small or very short statement. We can gather some very important information. The first thing that we can gather is that the purpose of our letter is to write a discharge letter. So again, therefore, the focus would be more on the what type of care and continued management would your patient be requiring from your recipient. In this case, a nurse in charge at the Rosewood Care Home. We also know, based from this statement, based from this writing task, that our patient, Ms. De Santo, is already a resident of the care home. Therefore, it's logical to assume that they would have um, information that is relevant to the patient. That is their social and family history. So let's have a look at some of the items that we will include in our letter for this writing task. So we're going to take the items relevant to our letter, and there are 7 items here. So in this example that we have for a discharge letter to the nurse in charge at the Rosewood Care Home, where Ms. DeSanto is a resident, the person you're writing to is a nurse in charge. So you can use medical terms to describe Ms. DeSanto's condition, but try to paraphrase 2 technical surgical terms. Since the patient is a resident of the care home, it is logical to assume that the recipient will be familiar with the patient's medical history and social history, so we don't have to go into details. It's important to also provide a brief assessment of the patient's condition. And since the nurse in charge you're writing to will be in charge of providing medical care, you will also need to give details of the medication that needs to be administered and any follow-up action that may be required. So in general, this will be the items that will be relevant to our letter for this writing task. Let's have a look at the case notes for Ms. DeSanto. So what I'm going to do is I'm going to give you 5 minutes so you can have a read of the case notes and try to engage by focusing on the discharge plan so that you could relate all the remaining information in the case notes as to the information that your reader, the nurse in charge of the care home, would be requiring. So let me just set my timer. Okay, so I'm setting my timer for 5 minutes. On you go. You have 3 minutes left. Okay, so I'm just going to cut short the time because we're going to be focusing on each relevant part of the case notes. I think that would be best for everyone. So let's have a look. So again, going back to the writing task, which is we're going to write a discharge letter to the nurse in charge at the Rosewood Care Home. Therefore, our focus should be on the discharge plan. So the discharge plan is typically found just before your writing task, so just above it. So let's have a look on this slide. Okay, we are now looking at the second half of the writing task where we can see the discharge plan. Okay. So let's have a look at the first two information we have on the discharge plan, where we have monitor medication compliance. That's for the medication, which is for review at completion of current course, and also the verapamil to continue. Okay, so these are what we could consider to be the medication details of the patient. Now, let's take a look at the next three lines under the discharge plan, where we have elevation of right foot, bed rest, avoid weight bearing, ice if needed. So we could then group this into the category of post-operative care. So firstly, the discharge plan gives us some details about the patient's medication. And then the next set of information gives us the type of post-operative care that your patient would be requiring. Now, let's move on to the next set. So here, we could see that the patient will have a review at the osteopathy outpatients on the 7th of July, where the surgical boot and staples will be removed, as well as an application brace for support will be fitted. So we could then group them into the category of appointments. These are the review and the follow-up that patients would be requiring, that your patient would be requiring. Now, let's have a look. So far, we have three categories under the discharge. We have your medication details, your post-operative care or the patient's post-operative care, and the review and follow-up. We still have two information on the discharge. Let's have a look on the next one. The next one is equipment required, crutches, which will be provided by the hospital. So if we take a look at the existing categories that we have, we could logically put this or include this under the post-operative care because this will be related to the weight bearing, to avoid weight bearing, and the crutches will be able to help the patient with that. Now, the last information under the discharge plan, again, it's another appointment. So we could then put that under our appointments, review, and follow-up. There's another one just below the discharge plan, and that is the anticipated needs of patient. It says help with ADL, showering, toilet use. Again, all related to the bed rest and the post-operative care. So we could group them all together. So let's have a look at our grouping. Okay, so what we're doing right now is we're actually trying to organize information, okay, where they would logically belong. So for our group one, we could see here that this is all about post-operative care. And our group two will be the medication details. And finally, we have the appointments, the review and follow-up, which will be our group three. So this will be our grouping. So if, for example, your reader, upon reading your letter, is now wanting to confirm the appointments of the patient, if you have this in the same group or in the same paragraph, then it will be easier for the reader to find this out. If the reader is wanting to confirm all the post-operative care that Ms. DeSanto would be needing, then if you have that in one area of the letter, let's say in your second paragraph, then it will be easier for her or for him to confirm all this information. That's similar to if the if your reader, if the nurse in charge is wanting to confirm the medication that needs to be continued for your patient, if you have that in one group or in one category, then it will be so much easier. So what we're addressing here is the criterion of organization of the writing criteria. Okay. So far, here are the information that we were able to gather from the discharge plan. That is our group 1 post-operative care. And we have our group 2, which is medication, the medication details. And we have our group 3, which are the appointments and the follow-up. Okay. Right. Okay. So because we've already gathered this information from the discharge plan, and we know that this is the heart of the case notes as you are tasked to write a discharge letter, we're now going to look at the first part of the case notes. So we'll be able to determine or identify what other information will be relevant to our discharge letter. Okay. Okay, so as part of our introduction, we will, of course, be introducing our patient or the patient's name and her age as well. And on the body of the paragraph, we will be including the treatment, which is the right osteotomy, which was done on the 23rd of June, 2018. Okay, and we will also have, okay, let me just check that. And the next one will be the admission date, which was the 23rd of June, same day as the treatment or the surgery. And she was diagnosed with the right hallux valgus or a bunion on her right foot. We also have here her discharge date, which is the 24th. Okay, so the next day. And we have a second diagnosis, which is ongoing high BP. Okay, so what does this mean? Okay, so and we don't have a lot of information yet, but what we could see is we could probably relate that on the information that we found earlier under the medication under group 2 of the discharge plan, where we have 2 groups of medication for compliance and verapamil, which is to continue. So this might be related to the ongoing high blood pressure of the patient. Okay, right. Okay, again, on the right-hand side of your screen, you will still be seeing the groupings that we did earlier under the discharge plan. We're now going to try to complete our introduction or the information for our introduction and for our body paragraph. So the information that we gathered from the first part of the case note are the name of the patient, her age, her diagnosis, as well as the admission date. And to introduce the treatment, she had a right osteotomy. Okay, we're now actually looking at the next part of the case note where we have 4 information here or 4 headings. The first heading being past medical history. We have medical background, nursing management, and assessment. So we're going to have a look at which information here will be relevant. Okay. So under past medical history, if you take a look, the relevant information here would be the hypertension, as this was mentioned as a secondary diagnosis, and that under the discharge plan, there is an instruction there for the verapamil to continue, which is in this case, the hypertension medication that Ms. De Santo has been taking, and she has had the hypertension since the age of 50. The rest of the medical history, we don't need to include them because we are discharging back to the nursing care home and they should have information about her past medical history. So in this case, it will not be as relevant as the hypertension medication. Again, that's connected to our group 2. Okay. And then we have the dosage there. If we take a look at the nursing management, so we have their vital signs, normal limits, and ECG normal range. If you take a look at below that, there's a heading there for assessment, and it says it's overall good progress. So we could use that to present the patient's current condition. Okay, right. If you notice that we skip on the medical background in terms of how the patient presented when she was admitted to the hospital for the right osteotomy, this is not going to be as relevant to the nurse in charge. The nurse in charge would be focusing on the continued care and management that your patient would still be requiring after the surgery. At the same time, another reason why we can exclude this information is that because she is a resident of the care home, it's very possible that they are already aware of her complaints, of her symptoms, and could also be the ones who have actually referred the patient to the hospital. So this information may be something that they are already aware of. Okay. So under nursing management, again, important information would be the medication. Although these two medication have been mentioned under the discharge plan, under the nursing management heading, this is now where we can find the dosages. So this will be important because there is instruction to monitor the medication compliance. So we need to include that for our reader. Okay, so our discharge plan almost looks complete. Okay, again, we have our introduction, and then our body paragraph 1 would include the treatment, the surgery, which is the right osteotomy, and we also have the patient's overall progress or overall condition. And then we have the 3 groupings for our discharge plan. Let's now have a look at a sample letter for Ms. DeSanto. Okay, so we did not include any more the address on top of the letter. Okay, that will be given. That will be for the layout. We're concentrating on the actual letter. And if you focus your attention on the first paragraph, you could see here that we have included the admission for Ms. DeSanto. What is the reason for the admission? And also the purpose, which is she is due to return to Rosewood Care Home. So the reader would be able to immediately understand that or identify that the purpose of the letter is for her to be discharged or for them to take over the care of Ms. DeSanto. Now, let's have a look at the second paragraph, which we call the body paragraph, because this is where your reader would then be expecting specific details about your patient. We have to include her treatment. So her right osteotomy was successful. Also her overall condition, which is she's making good progress. And this is now where we also included our group 1. Remember our group 1, which is the post-operative care, the mobility and post-operative care. So we included there the bed rest, the elevation of the right foot, also that the hospital has provided the patient with crutches for mobilizing. And we've connected that with the information or the instruction to avoid any type of weight bearing. We've also included application of ice will be helpful for his pain and swelling, and as well as our requests for assistance in her daily activities such as toilet use and showering. So this is our organization. Now let's take a look at the second body paragraph here. We have included our group 2, which is medication and monitoring. We've included now very specifically the dosages as well, and also that we have included the information about the hypertension medication verapamil that must continue as well. And of course, we would appreciate their support or the nurse in charge support in making sure that she complies with the medication. And then the last body paragraph is all about the follow-up appointments and any reviews. So we've included the review on the 7th of July at outpatients. We've also included information as to the removal of the surgical boot and staples, as well as the application brace for support. We've also included the assistance with regards to the management and the monitoring of her wound, since the surgical boot and the staples would have been removed by this time. And lastly, this is where we have included the session about the physiotherapy, which will be arranged during the orthopedic review. And as part of our letter layout, on the last part is where we have our closing statement. So a very short one. It could be something as, please do not hesitate to contact me should any issues arise. And we close our letter with yours sincerely, as we know the name of the reader or the person we're writing to, and we just sign it as nurse. Okay. As you could see, imagine if you were the nurse in charge and you're a very busy person. Healthcare professionals probably will not have time to rifle through information. So the way this information has been organized has should make it easier for the nurse in charge to find information easily. So if she's wanting to find information about a medication, she could just immediately go to the third paragraph where it has all the dosages and the types of medication that must be monitored and must be taken by the patient, as well as any follow-up appointments on the last part of the letter, and post operative care and mobility have been included on the first body paragraph. So I hope this is helpful in terms of organization. And this is what we've noticed with most students, that this is one criterion or one area of the writing task that most students have a difficulty with. So I hope this has shed some light on how to organize your letter for a discharge. Now, let's have a look at another sample, and this time it's for our doctors. So here is our writing task. So the writing task is to write a discharge letter to Dr. Hodges, the patient's GP, informing her of the treatment Mr. Aloysius has received and advising on future management. Okay, again, a very short sentence, but it contains a lot of very useful information for us. So the writing task tells us exactly what type of letter we're supposed to write. It's a discharge. Not only that, but the writing task also specifies that we're supposed to inform the patient's GP of the treatment that Mr. Aloysius has received, as well as future management. So the writing task is in fact telling us which part of the case notes we should focus on, and that should be the treatment and the future management. We also know that we are writing a letter to the patient's GP. So there is an assumption that we don't need to go into details in terms of the patient's medical and social history, because the patient's GP would be expected to have some information, some background about the patient. Okay, so the items that will be relevant for our letter in this example would be, we will still be able to use medical terminology since we're writing to a medical professional. And we need to provide Dr. Hodges an assessment of Mr. Aloysius' present condition, as well as to provide details of the treatment and or medication, which is very specific on the writing task. And if there's any follow-up or any review, we need to mention that as well on our letter. So let's have a look at the complete case notes for Mr. John Aloysius. Okay, we're going to be discussing this um, per heading later on. So I'm just going to give you 2 minutes to just have an overview of what the case note is about. You may start reading. Okay, right. I'm sorry, I'm not giving you the actual 5 minutes because what we will be doing is because it's a discharge letter that we are tasked to do. Again, remember the focus of a discharge letter would be specifically the continued care and management that the patient would be requiring. For doctors, it will also be essential to include the treatment that the patient has received. This is something that the GP would appreciate. So rather than starting from the top of the case note where we have the patient details, it's always best to read the discharge plan just immediately before your writing task. So that's what we're going to do now. Okay, so this is the second half of the case notes. We're going to be focusing on the discharge plan. Okay, so here we have several information here on the discharge plan, and this all relate to the medication details. First line specifies that the 4-drug regimen should be continued for 2 months. And there's additional information about 2 types of medication that would have to be stopped after 2 months. Again, all about medication details. And next line includes information about 2 medication that can continue for 4 months. And the last line indicates the need to monitor medication compliance and that it's possible that it may be reduced to 3 times a week after 2 weeks at the initial dose. So again, a lot of medication details, and this would be pertinent to our reader because this is part of the discharge plan. Right. Okay. Now, the next set of information under discharge tells us or gives instruction to the reader about the post-operative care that Mr. Aloysius would be requiring. The first one being to monitor for toxicity, baseline and periodic serum assessments, and also that Mr. Aloysius would be requiring visual acuity and color perception tests. So that would fall under post-operative care. So far we have 2 groupings here. We have the medication details, and then we have the post-operative care. We have another line, last line under discharge, and it's about vitamin B6 supplements. So we could include that under the medication details as well. So for this case, we have 2 groups under discharge, medication details and post-operative care. Okay. All right. Okay. Okay, we're now going to be looking at the first part of the case note. So we could then see which information will be relevant to the reader based from the instruction that we were able to gather from the discharge plan. So as part of our introduction, we have the patient's name and okay, the patient's name, we don't need to put in the marital status because the GP would be aware of that already. That would not be pertinent. We need to include the social background just because if you see here, the most important information here is not necessarily the occupation because the GP would probably be aware of this, but the information that Mr. Aloysius recently returned from a year-long visit to the remote region of Latin America. So this might be something which will be relevant. What kind of illness? It's possible that this might be the reason why, and this might be if there was any an illness or a condition, he might have picked it up during his year-long visit to a remote region in Latin America. So we have information as to his admission date, and that is the 1st of February. He was admitted to A&E. And we have the presenting problem. So he presented with night sweats and fevers, cough, and other information. So these will be the presentation details. Okay. So, okay. I just want to remind the doctors, having established that most stakeholders agree that too much information can make a discharge worse, it is a consensus that in the area of discharge letter, the part that can be downsized would be the presentation. So this would be the presenting complaints of the patient. So all stakeholders agreed that the presentation on admission should be limited to 1 or 2 sentences. We should only be including salient points of a presenting history. Okay. And the diagnosis is pulmonary tuberculosis, which will be part of our introduction. Now let's take a look at the rest of the case notes information. This is where we found the discharge plan, and the information just above the discharge plan are the treatment and test results. Remember, one of the focus for a GP discharge letter would be to inform the GP of the treatment that the patient has received. So let's have a look into that. Okay, so these are exams and treatment conducted on the 1st of February, on the 3rd of February as well, and on the 11th. Okay, we're just going to be picking out the most important information here. So only relevant examination findings and examination and investigation should make it into the discharge summary. Sure, a normal neurological and PR exam, for example, in a pneumonia patient, may be a sign of a thorough ED resident. However, if the patient did not develop a stroke or PR bleeding during an admission, okay, not for this case, this can safely be left out from the discharge summary. And that's what we're going to do with the information here on the treatment and test results. What would be the most important? Okay. Similarly, under investigation results, most stakeholders felt that investigation results, pathology, imaging, other tests should only be included if they are significant or needed to be followed up. Okay, so medical progress, condition of the patient is good. Okay. Right. So this is our discharge plan for a letter. And so far, we have the 2 groups that we were able to identify from the discharge plan. The group 1, which is the medication details. And then we have group 2, which is the post-operative care. And then for the introduction, we're going to be including the diagnosis, which is pulmonary tuberculosis, the admission date, and that he may have picked this up from his overseas trip to Latin America, and also his current condition, which is good. Okay. For our body paragraph 1, we could include his presenting complaints, the tests that were done to determine the diagnosis, and the treatment that was also rendered to the patient. And that's respiratory isolation and the 4 medications that were started for tuberculosis. So let's have a look at the sample letter for this case. Okay, right. So the letter is organized into 4 logical paragraphs. The first paragraph includes the admission to the emergency department on the 1st of February. It also includes the overall progress and the diagnosis of the patient, and that the purpose, which is he will be discharged back into your care today. And then let's take a look at the next paragraph, which is the body paragraph. And this is where we can find the presenting complaints, the tests and the treatments that were conducted for Mr. Aloysius. Okay. And then the next paragraph talks about the first group under the discharge plan, which is the medication details. So what needs to be done? So it's been included here that the 4-drug regimen should be continued for 2 months, after which the 2 medication should be stopped, and the remaining 2 medications should be continued, as well as the vitamin B6 supplement. And then the last paragraph includes information about post-operative care, medication compliance for any side effects, as well as CBC count, and the tests for uric acid and creatinine assessments. And finally, we've included there the Ishihara color blindness test as well. And that's it. That's how we can organize this information about a discharge letter for Mr. John Aloysius, who has been diagnosed with pulmonary tuberculosis. Okay. So I have some more before we answer some of your questions. If this has not been answered yet by our OET teacher on standby for the questions, I just have some more tips for doctors with regards to discharge letters. So for our doctors, okay, it has been agreed by most stakeholders that what you should not miss on a discharge letter would be if there are any changes in the medication, and what are the reasons for any changes. So this should be something that you have to include on your letter. Also, main and secondary diagnosis and any issues that may have arisen during the admission, we need to include this as well. Again, we need to be as specific as concise as possible. For example, a right middle cerebral artery infarction due to AF, okay, versus just writing CVA. Also, you would need to include any results of relevant investigation. Okay, again, if they are relevant as to the diagnosis or as to the continued care that your patient would be requiring. If there are any post-operative or complications that have arisen due to the procedure, we would need to include, the doctor would need to include that on the discharge letter to the GP. And finally, any identification of new allergies that the GP may not be aware of, we need to include that on the discharge letter as well. Okay, so right, I'm going to open the floor for any questions. Let me just have a look if some of your questions have already been answered. Okay, bear with me for a second. Okay, I think Grace has been monitoring our questions. So I'm just going to give my final remarks about the discharge letter. And I just want to share that the importance of discharge summary should not be understated. Um, it's amazing to think that this information rests with the single lowly regarded discharge letter. So again, for both our nurses and our doctors, for discharge letter, the typical focus should be what kind of continued care and management the patient would be requiring. So rather than the focus on the social and medical history, especially if the person you're writing to, whether it's the care home or the patient's GP, they would already have information about the patient's medical history. Okay, right. Okay, so if you have any more questions, please feel free to leave us a message either under the comment section, or also you could send us a direct message on our Facebook page. And just want to announce as well that next week we're going to have our next tutorial, which is about OET Reading Part A. Quite exciting. Okay, this is one of my favorites. Again, thank you very much for joining us on the SGR Writing Part 2 tutorial. I hope you were able to pick out some important tips on how to organize and how to pick relevant information, and make sure that you don't include irrelevant information that may distract the reader from your main message. Thank you, everyone, and have a good day and keep safe. Bye.